Hi, everybody. This is Jill Swartz with Specialty Med Training, and I am excited to be here with Dr. Lamia Gabal from Prestige Medical Group in California. She's a board-certified urologist who is really paving a path in this whole world of male and female sexual wellness, and not just dealing with urological issues, but really helping men and women prevent sexual wellness issues and really be their best selves in as it relates to sex, and it's such an important part of who we are as human beings, and it can't be overlooked or waited to become a problem. So Dr. Gabal, thank you so much for joining us.
Thank you for having me, Jill.
Yeah, and today we've embarked on a mission. Dr. Gabal has really wanted to take time out to educate her patients and consumers alike, just really the general public, on the different options that are available. The field of regenerative medicine is growing so quickly, and how it's applying to urology and your particular area of specialty is oh my gosh, it's exponential how much it's changed in the last handful of years, right?
Absolutely. So excited to be able to use these things and not just for my patients, but personally as well. It's very exciting to live in this day and age where we have this capability.
Yeah, and she's dedicating her time to really to educate us and let us hear firsthand from the doctor what these options are for us. So today specifically, we're going to talk about a fairly new treatment called P-Long, and it's very new to me. So I'm excited to learn as much as I can learn during this our talk. So yeah, please take it away and tell us about this new procedure that you're offering.
Thank you. Yes, I'm excited. So this is a revolutionary new protocol that's taking some older therapies and combining them into a treatment option that helps for penis elongation and not just elongation, but also girth. So to increase penis size. One of my colleagues, Dr. Judd Brandeis, he's a very well-respected urologist up in Northern California. He's also always been on the forefront, on the cutting edge of regenerative therapies, and he developed this protocol. So it's super exciting. I'm excited to be able to offer this to my patients, to men who are interested in increasing their penis size. You know, what's interesting about this is, of course, this doesn't get talked about in mainstream. I'm happy to talk about these things as people who know me. You know, I have no filter. And, you know, women have been able to get their breasts enlarged for so many years. And at first, it was also controversial. And it wasn't talked about, and oh no, did she or didn't she? And so now, you know, it's very normal and mainstream for breast enlargement. Well, that's what we're trying to get to also for men, for penis enlargement. And there really hasn't been a safe, minimally invasive option for men to be able to increase the size of their penis. You know, there are some other options. There's surgery, which has the risk of infection, anesthesia, downtime. There's some fillers which need to be repeated over time. And quite frankly, both the fillers and fat grafting is another option. They don't give a very nice aesthetic effect, if I may say so. They kind of end up looking a bit like a potato. And then there's also a suspensory ligament cutting, which has been around for many years, which really, it also involves general anesthesia, and it only gives a very tiny amount of length and no girth. So, you know, when we talk about the things that are already available, they are not ideal, they're expensive, there's surgery, there's downtime, and then there's the risks of infection and those kinds of things. So Dr. Brandeis developed this wonderful clinically proven protocol that he's done a study looking at 6 months of data, and it really has been proven to increase both the length and the girth of the penis. So the protocol, if you look at the study results, there was 0 negative side effects, There is no downtime. It's completely safe because we're using your own tissue. It is done under local anesthesia in the office. And a third of the men found an improvement in their erectile function as well, which we'll get to that later when we talk more about the protocol. But 100% of the men in this study showed increased length and girth with an average of almost 1 inch of length and about half an inch in girth with a 6-month protocol. So it's super exciting to see these results. Yeah.
Yeah. And it's non-surgical and it's all natural. So I'm excited to learn, to hear about what they're using. So tell us a little bit about what's involved in the actual protocol itself.
Yes. So PRP is an exciting regenerative option that we have now for our patients. PRP stands for platelet-rich plasma. It's been used for over 20 years for many different effects, for regenerating tissue in many different parts of the body. The orthopedists have used this for many years for post-operative healing in joints and muscles and tendons. And then it's been used very safely for the last 10 years or so for sexual medicine, for both an O shot or a P shot, O shot in women into the G spot, P shot in men into the penis, where we re-inject these healing factors to help regenerate nerve endings, blood vessels, collagen, elastin, to really help for sexual function. And so Dr. Brandeis took this one step further, taking this already proven safe regenerative treatment and adding several things to the protocol. So it's a platelet-rich plasma injection once a month for 6 months in the office, no downtime. You use your penis the same day. Taking a nitric oxide booster, which is just an oral pill that really helps increase blood flow to the penis. So that's super important for the protocol. And then there is homework that you have to do at home as well. Using a vacuum erection device twice a day for 12 minutes, which really helps bring more blood flow to the penis to really encourage that cell regrowth and get more healing factors to the penis. That's what we're trying to do. And then the Restorex traction device, which is another device that's been safe and proven for Peyronie's disease. It's been used for many years for stretching the penis and breaking down scar tissue to help straighten a curved penis. And so that we're now using twice a day for 30 minutes in this protocol to help stretch those cells. So again, when I tell my patients about this, it's much like putting a tissue expander for a breast, that if you're slowly expanding that skin by using the traction device, the vacuum device, which I should add, has been used many years safely for erectile dysfunction as well. Taking the blood flow booster with the nitric oxide supplement, and then adding the PRP, we're really modeling those cells to stretch both in length and in girth. And that's what Dr. Brandeis proved on his study, that we definitely get gains.
So interestingly, because I know, and we've done a talk on the P shot, which is, or the Priapus Shot, that utilizes PRP and pumping. So if you can, just talk to comparatively and the differences between them, and then the type of patient who would be more ideal for P long as opposed to P shot. That's important discussion.
Yeah. So it's interesting because we've had P shots available long before we've had the P long protocol. And traditionally, the model patient for a P shot would be a man in his 50s or 60s or 70s who's, sexually active, maybe having some difficulties with maintaining 100% of an erection, wishes to maintain his sexuality for longer. And by adding 1 or 2 or 3 injections of PRP in sequence, plus using the vacuum device twice a day to maintain the blood flow, that's really been shown to help for erectile function. We were not looking at penis girth or length at that time. However, anecdotally, Dr. Runnels, who developed the P shot and O shot, did notice that in his patient population and in reports that many of his patients noticed an improvement in penile length and girth. Now, some of that we assumed at the time was just because really the penis is a use it or lose it organ. Like I have so many men who come to me every day and they say, well, my penis has shrunken. Well, it's because you're not having an erection. It's like any part of your body. If you don't use your biceps for a while, we know that that muscle atrophies. And the same thing happens in the penis. If you're not using your penis for a while to have an erection, everything shrinks, everything atrophies. And so we want to maintain blood flow. We want to maintain the use of the penis in order to get, to get better function. But also we know now that if you maintain the use of that organ, it's not going to shrink. So Dr. Brandeis, being brilliant, then took this one step further and said, let's see if we can actually get gains in a younger population. And so, in his study, the participants were men in their 30s, no real trouble with erectile function. We're only looking for gains in length and girth. But interestingly, a third of those men who were reporting no erectile dysfunction at all noted some improvement in their ability to achieve and maintain 100% of an erection. And so this protocol is meant probably for a different population, but is still applicable to any man who wants to increase girth and length and increase function as well.
Yeah, so I guess that the crossover in function is important because we know PRP is used in both, and that's a tool for rejuvenation. So they kind of go hand in hand. So,
yes, because you can't have one without the other. We're restoring total function. You can't pick and choose which cells you're restoring. So we are restoring nerve endings, blood vessels, collagen, elastin, all of those things, which are important for length and girth, but also important for function. So that's a nice added bonus.
But it would be safe to say, there's two applications in two different types of patients. The man who is experiencing, regardless of age, experiencing functionality issues might be a better candidate for the P shot along with other combination therapies perhaps. Yes. And then someone who's looking primarily for length and girth, the P long would be likely more appropriate
for him.
Okay. Yeah. So just to kind of recap, it's definitely completely safe. Again, it's using your own blood, right?
Yep. Totally safe. PRP really has no risk, no downtime. There's no allergic reaction. It's we're taking the cells from your own body and just concentrating those healing factors and re-injecting them into the area that we are trying to regenerate. And on that note, the blood is taken from your arm, and then we spin it down to just a smaller amount of these healing factors. I'm injecting it using an ultrasound into the shaft of the penis, so on the sides, not into the head of the penis. That is a much more sensitive area, and I know many of my patients are concerned that that's where the injection is going. It's going onto the shaft on the side. It's very, very tolerable. Honestly, I do these in the office. I put some local anesthesia onto the skin so that you don't feel the needle going in. It's a tiniest needle, smaller than even a diabetes needle. Many men are, my patients are able to tolerate it without a problem. It's a slow injection, and you can go home and use your penis right away. In fact, some men find benefit right away because now we've added volume to the penis, and that does go away over the next few hours. But we're adding about 8 cc's of volume immediately that then your body will resorb into that area and use those cells for regenerative therapy, for the regenerative uses. Yeah.
It definitely sounds like a home run, a win-win, I can imagine. Yes. And then is there anyone who's, you've kind of clearly said the best candidate, and is there anyone that there's an exception to that?
Yeah, so someone who's already had fat grafting or filler is not a great candidate for this. It's tough to get through that, into the shaft of the penis. Also, the pneuma is a device that's implanted under the skin surgically. So if a man has had that previously or even had it removed, probably not a great candidate because there's lots of scar tissue going on there that would be difficult to stretch. Not to say we can't try, but if the device is in place, definitely we can't do it. But the scar tissue after the removal would be difficult to treat as well. And then if you're a smoker, it's not something I would recommend, because smoking just really affects how our cells are able to heal and regenerate. And, you know, we'd want you to stop smoking before we're able to do any of these regenerative therapies.
Yeah, and I definitely really respect too, Dr. Gabal, that is, I mean, that's the type of practitioner you are. You're not going to overpromise or overdeliver. You're going to treat people who really want to help themselves or in a position to make themselves better. And again, I've mentioned this before, but that's what's incredibly important about working with a doctor like Dr. Gabal and the other doctors at Prestige Medical Group, is that you do take this very integrative approach to your patient's wellness, and you're really looking at the whole picture. And it's really important to be seeing a doctor who can take that approach, even being a traditional urologist, but you have just gone and taking the steps to learn a tremendous amount about the regenerative side of this as the science is progressing. So hats off to you for that.
Thank
for sure.
you.
And
super exciting.
And as you said, I think you stated from the study, 100% of the candidates got some increase, notice some increase. So it's really, this is about results. So please tell your listeners where they can, how they can get started, because I'm sure your phone's going to start ringing off the hook if this is the case.
It's such an exciting therapy, I know. And really, we've seen results already in our practice with it. So feel free to look us up online. You can go to prestigemedigroup.com. That's MEDI group.com. You can look up my name, Dr. Gabal, DRGABAL, or you can call my wonderful patient care coordinator, Teresa. She's happy to help you through this journey and help you to get started. Her direct phone number is 949-387-0411. And we're so happy to be able to help you with all this.
Awesome. Great. Thank you so much, Dr. Gabal, again. And all you listeners out there, stay tuned, because she is dedicated to continuing this type of education for all of us alike. And we're learning so much, and we're so grateful for your time. Thank you.
Thank you. Thank you for having me.
Yes. Have a wonderful rest of the day.
Thank you. You too, Joe.
Thanks.